Hello, everyone. My name is Luis Perez, and I'm the president and CEO of Mental Health Connecticut. May is Mental Health Month, and this month we are celebrating not only Mental Health Month, but the 112th anniversary of Mental Health Connecticut. And with me today is Eric Galvin, president and CEO of ConnectiCare, a great supporter of mental health overall, and also of Mental Health Connecticut. Welcome, Eric.
Well, thanks for having me, and really glad to see your face, see that you're well, and look forward to seeing you in person soon.
Yeah, likewise. I think that we all need that, even though it's nice to see each other virtually, I think that as human beings and part of the human condition is that personal face-to-face touch. So I agree with you. And certainly, during this very difficult time, we do need to pay attention not only to our physical health, but also our mental health. And I know that ConnectiCare has been the forefront of supporting all sorts of activities through the last few weeks. I know that you've been doing wellness checks, which I commend you for with your members. So I was wondering, where did you get the idea of doing that, and how has that been going?
Well, so it's interesting. If I think about doing those kinds of wellness checks, we do this each and every day. It's part of who we are as a company. It's part of who we are as people. But during this crisis, we thought that wrapping a little bit more structure around it, and as a result, we ended up calling it something. We ended up branding it, if you will, the Peace of Mind Initiative. And really what our intent was to outreach to those who were at the most risk for having some complications related to COVID-19, and just checking on them, not only asking if they have questions that we could help with around health insurance or their coverage or their prescription medications, but did they need help with other things? Did they need to connect to resources to help them with paying their bills, utility bills or what have you? Did they need help with food and sources of food pantries? So we found that there was a wide array of needs, and we made tens of thousands of outbound phone calls to our customers. And the most heartwarming aspect of it is that they really appreciated it. They really appreciated just having some interaction. Some of our more vulnerable folks who are either elderly or living alone, they just needed somebody to talk to, and so we were happy to be that person to chat with.
What a great initiative, and what a great way of connecting and letting people know that you care and that they are important, and that is such a big component of having people feel a sense of security, right? Because they're not alone.
No, not at all. And and thank you for the kind feedback. But we feel like it's our obligation. It's what we're here for. It's our purpose. So not only are we happy to do it, but we're mission bound to do so.
And that's what differentiates ConnectiCare, I believe, from others. So again, good for you, and good for your members, really, to be part of such an amazing organization. Talking about that, telehealth was really not had a great penetration here in the state of Connecticut as opposed to other states, and it has now become, through executive order, something that we can do. What do you foresee in the future in terms of the implications of the regulations being lessened, and do you think that will go forward in the future?
Well, we certainly would like it to go forward and be really a cornerstone of how people access care in the future. We think about just the lives that people live being so busy, whether that's in a pre-COVID or in a post-COVID world. People's lives will continue to be busy, maybe more so and in different ways. And so as we think about that, what better way to try to fit in accessing care of all kinds, whether that is primary care for your mental wellness, or primary care for your physical wellness, or just frankly good well-being and mindfulness. So we think it is a cornerstone of what should be part of our healthcare ecosystem going forward. And now that there's been a bit of a catalyst to make that happen and show practitioners that it isn't a scary thing, and show insurers that it is something that that customers will take well to and can be effective, there's no excuse not to find a way to keep it here.
No, I really agree with you. You know, Mental Health Connecticut a few years ago made a huge investment in technology. You know, our residential counselors, our rehab assistants all have iPads and the ability to communicate with their program participants, and that has been made such a difference. Again, back to your comments about people not feeling alone and having those wellness checks once, twice a day, and prioritizing which ones need the higher level. And I think that telehealth is another way that practitioners can support it. So I full-heartedly support that, and would be happy to have more conversations with you around how we can further the penetration of utilization. And do you foresee that there will need to be any legislative action? And if so, how do you see that working out, and any barriers that you foresee?
Well, I certainly hope legislation is not needed. I hope that all of our peers in the marketplace will recognize the place that telehealth has in the world of tomorrow, and do the right things by it, right? So that means making the right kinds of infrastructure investments, and if we need to partner, finding a way to partner to make those investments, or making it work within the schedule of any particular practitioner. No easy feat, right? And depending upon what your specialty might be, it may lend itself better or not as well to that kind of a practice. You know, ultimately, I hope what it does is it increases the access, but also increases the quality of the interaction. I am certainly understanding that, you know, charting has a lot of focus and attention, but having, you know, eyes to eyes with your practitioner, your physician, your therapist, whatever practitioner you happen to be seeing, is so much more impactful. And I'm hoping that that telehealth will open the ability to do more of that eye to eye, or, you know, virtual face-to-face interaction. So just to wrap up that thought, you know, I certainly hope legislation's not needed. And, you know, it really is going to come down to different parts of the industry putting down the silos that they come from and thinking about it from the patient first. That's what I hope happens.
Great. That's very important. And for us in the mental health but behavioral health world, again, another very important step, often because of the discrepancies that we have in the state. We're such a small state, right? But the amount of practitioners, the access to services, whether you are in the eastern part of the state or in the northwest corner, it is very difficult for folks. And unfortunately, the COVID crisis has also raised the issue of health disparities, right? And again, the access for people of color to be able to access quality care, not just care, right?
Absolutely.
Yeah, and this could only
just.
Yeah, go ahead.
Yeah, sorry. No, just a quick thought on that, Luis, is, you know, one of the things that we have always, as a healthcare insurance industry, had to really work at is access within certain geographic circles, right? How many miles of travel to get to whatever type of provider. This really does open up the aperture much broader. So if somebody is in Torrington and the right specialist is in, you know, I'll just make up a town, Groton, then we're not having to necessarily worry about that travel time. Now, if it's a specialty that hands-on or physical interaction is critical, harder to solve for, right? And
Sure.
and I think we're all reasonable people and can navigate through that. But no, I think the opportunities here are tremendous.
Yeah, I couldn't agree with you more. Couldn't agree with you more. You know, as we're talking, it occurs to me that different industries, but different, but very similar values between our organizations.
I think so.
And we have been moving our philosophy to not just focus on mental health. You mentioned earlier whole health, mindfulness, all of those things that make person, we can't separate the head, right, from the body, and that interaction is so important. And it occurs to me that sometimes crises bring about change, and hopefully positive change. So how do you foresee the impact that this is having in our healthcare system, in the larger healthcare system, towards evolving a whole health approach?
Yeah.
I know that the Affordable Care Act made some great took great steps to ensure that, and as that has come under scrutiny and criticism, some of it is falling off, and I get concerned about that. So would love to hear your thoughts on how this could help us promote that.
Well, so Luis, the other day, I happened to be on a webinar about InsurTech, and one of the themes of the conversation ended up really being about the fragmentation of our health ecosystem, or the fact that we don't really have a health ecosystem. We have a lot of industry verticals that work in sometimes close and sometimes less close or disparate partnership. So what I would hope comes out of this terrible crisis is that we do find a way to assemble the ecosystem to work much more seamlessly together. As you said, you can't separate someone's mind from their body, and there has long been a divide between physical health and mental health and well-being. And looking at someone from a holistic standpoint, it includes their financial health, right? The stresses that they face in trying to provide for themselves, a family member. That whole picture is how we should be orienting around an individual in a patient. And we've tried it in different ways, care teams, multi-specialty care teams, and have made some progress, right? But I think this is another really great inflection point where we can say, okay, we have another reset opportunity here. Let's take advantage of it. And those are the conversations I'm really looking forward to having, not when this is over, but as soon as now. And I'm really glad that you've invited me to have this chat with you, because if we don't start now, then there'll always be a reason why we, couldn't get the time or couldn't get the conversation going. So let's get at it.
Right. And, I think that, practitioners, people that go into healthcare professions, right? They do have, a mission and a personal value system, right? But, and I don't mean to put you on the spot on this one, because again, I know that your organization is perhaps different than others, but I often hear from private providers, particularly PCPs, that the time to take to do a screening or a wellness check overall infringes on their need to have to see X number of patients a day. So how do you foresee, or are there any good models out there, right, that would be able to address that, and so that we can engage the private practitioners in particular, not necessarily the clinics, although the clinics certainly have that kind of a financial stress as well. So, any thoughts on that, so that we can engage the people in the front lines?
So first of all, we just finished, as you know firsthand, we just finished Nurses Appreciation Week. just a few days ago. And, you know, in reading the stories, not just of our own nurses and frontline people, but of the amazing heroes that are out fighting this virus, you know, you're reminded that it is a calling. It's a mission that they've chosen to engage in their life, and that the system that has evolved over time has put a lot of pressures on them to be more production line workers, right? Let's get to the next. Let's get to the next. You know, I was talking about charting just a moment ago as one of the offshoots to that. You know, I think there are a number of models. Connecticut happens to be a little bit unique in that we're a little bit behind the times in terms of progressive reimbursement models, you know, going back to kind of capitation, if I could use the industry term for a moment, of, you know, paying care teams for an individual's care, regardless of whether they're seen or not. And so I think that there are some ways that can be effective. We study other regions of the U.S. that are effective at it, some that aren't, and why not? You know, I'm thinking of some comments that, you know, my colleague and friend Jess Kupek, you know, formerly of St. Francis Healthcare Partners, he would say, you know, if we're going to sit down and start talking about our contract and how much we pay one another, then the conversation's over before it starts. And so, yes, there are models. I would encourage us to talk about what needs to happen in that ideal care model for a patient, and let's figure out how we pay for it as a second step. But let's bring the right resources to take care of that person from head to toe. I hope that is a satisfactory answer. I know we could probably talk for hours on end about this.
Yes, I think that's one of the things that you and I share is that there's no worse position to be in than to think that you created the wheel, and that there are other wheels out there that are working great. There are some, as you mentioned, that are not working so great, so we can learn both from the best practices as well as those missteps. And I think that sometimes we come short from being able to acknowledge as leaders that we need to look elsewhere for those answers, and they don't always lie here. And I think that you know, as you were talking about your both your nurses and your healthcare professionals that work for you, I know that for us it's been very important to make sure that our workforce is supported. My first clinical supervisor, first time I met with her, she said, you know, one lesson that I want to get through to you, and that is, if we don't take care of each other, we can't take care of others. Right?
Very true.
And so we have paid a lot of attention through the last, we always pay a lot of attention, but particularly, you know, people are, some of them are working remotely, their children at home, the stressors of balancing work life. Perhaps your significant other is an essential employee, perhaps even working, you know, providing healthcare services in the front line, which adds another level of stress and concern. So how are things been going with your team, and what kinds of things have you been doing as a, you know, that others can learn from and replicate?
Well, I don't propose that we have, you know, the best wheel, to use your analogy. I appreciate you asking and having concern for our team members. I have to tell you, I'm just so fortunate to work with the team that we have. These are people who have been dedicated and, you know, tirelessly working. I mean, it goes everywhere from the security guards in our buildings all the way through into those people that are on the telephones, or, you know, in some instances we've had to do some in-person types of interactions to try to get people what they need. How are they doing? You know, they're tired, but they're committed, and they're eager to get back to normal. And, you know, I think you and I would agree that I don't know any of us necessarily know what that really means. But I have to say the entire team has just stepped up to this challenge in the best way that I can think of. And so I'm sitting here with you having this great conversation, and frankly, all of the work that we're talking about is done by the people that you don't see. And that's what makes the company great. That's what makes our communities great, is that we're filled with people like that. So I think they're doing fine. I think, you know, I like to try to kick people offline at a certain point in time during the day, and, you know, hope that they're spending good quality time with family and doing it safely.
Absolutely. Yes. Self-care is such an important piece right now because that compassion fatigue can be even more detrimental. You know, during this month, we have several offerings through Mental Health Month, and I would encourage everyone who's watching to look what those opportunities are, and also going to our website. We have several offerings. You know, our mission goes beyond the provision of services, but also ensuring that we partner with all Connecticut residents around their mental health, whether they have a diagnosis or not. You know, back to the conversation we were having about whole health, and making sure that we are mindful of the stressors that we have, and this time is certainly one of those. But it's a great time also to celebrate great work, and we really enjoy our partnership, and want to thank you for taking the time today to be with me. Yeah,
absolutely. Please stay well, be healthy, be safe. I can't wait to be able to, you know, say hello in person, and we'll talk soon.
Sounds great, Eric. Be well, and if there's anything we can do at this end, let us know.
Likewise. Thanks.
Thank you. Bye-bye. Bye-bye, everyone. Thanks you for joining us, and I hope you will take advantage of all the offerings that Mental Health Connecticut has during Mental Health Month. Be well. Take care.